As one of the largest GAs in the country, Arrowhead has program management down to a science. Find formulas for success at arrowheadgrp.com/science.
With or without healthcare reform, changes in the way care is provided in the United States present new challenges for executives in the field and their insuring organizations alike. Speaking with Insurance Journal Stephanie Jones at the PLUS Medical Liability Symposium in Chicago, Jim Fasone, Senior Vice President of Alliant Insurance Services in Denver, Colorado, said healthcare executives face increased risks in an environment characterized by declining reimbursements and greater regulatory scrutiny.
Yeah, healthcare executives face more challenges than ordinary, given the continued evolution of the healthcare reform passage and what that may or may not mean, depending on how the Supreme Court finally rules in May. The challenges from a regulatory standpoint are numerous, including the declining reimbursements. They have financial challenges there. There's more investment in regulators coming in to make sure the coding and billing is done accurately and properly. So the healthcare executives have more and more responsibility to make sure that the organization is not only run well financially and operationally, but they comply with all the various codes and changes that are going on in a declining reimbursement environment.
While reimbursements have always presented a challenge for healthcare organizations, Fasone says current financial considerations and heightened scrutiny are causing healthcare organizations to rethink management strategies.
10 years ago, a lot of the challenges came from particular market issues. They always had reimbursement challenges to a degree, but it didn't seem as the regulators were as aggressive as they are now in making sure that the billing environment is properly done. There's been a number of reports that have come out of late that reinforce the OIG and other regulatory bodies' interest in going after healthcare organizations to make sure they're not improperly coding and billing the government and trying to recapture some of those monies. There's also an evolution now with a lot more mergers and acquisitions as companies try to determine whether or not they can survive in a new healthcare environment. In that declining reimbursement environment. So more and more companies are looking to either merge or come together with other organizations because they don't quite have the capital or leadership team ready to handle the challenges.
Fasone says despite the evolving nature of the nation's healthcare delivery system, specialists in providing insurance coverage for healthcare executives are able and willing to keep up with the changing risks.
Well, supply and demand works in the insurance industry like everything else. So even though there's an overall soft insurance market, as you stated, there's very few players interested in taking the lead or primary insurance role for directors and officers liability products. So having said that, the number of carriers that are in the market are very committed to it. They're committed to understanding more about what those emerging risk issues are, trying to put together terms and conditions that are not only satisfactory to meet their shareholders' needs, but also to conform with what the buyers are looking for as well. So I think we have some challenges up ahead, but fortunately there's a number of underwriters out there that are sophisticated enough to want to learn and educate themselves in order to take the correct risk. I think the insurance industry has been pretty adaptive at finding opportunities where there's a need out there. It's just like employment practices or cyber liability. I mean, the liability issues are evolving. They're creating products to respond to that. Reputational risk issues, Medicare fraud and abuse issues. There's products evolving for that. But we're talking about bundled risks now to a degree. There's going to be some gray areas between traditional malpractice and D&O risk and other broader emerging risk issues. And it'll be interesting to see if the industry responds to more of a broader product.